what was happening that brought you to see Michael?
Okay. The symptoms that I had when I went to see Michael were various. I used to call them my new adventures in old pain, because I had been in pain for almost 10 years when I found Michael. I had burning in my arms. I had numbness in my hands. I had numbness in my fingers. I had crushing sensations in my arms. I had neck pain. I had headaches. I had lower back pain. I had severe SI pain that sometimes presented as burning, sometimes presented as a feeling of pressure. I had muscular spasm, very severe in my traps, in my glutes, in my quads. I had hamstring tightness that did resolve before I saw Michael, but what resolved the hamstring tightness actually worsened almost everything else. And I had periodically elbow pain. I think that's all of it. But again, every single day it was something different. And it started in 2008 when I was in a car accident. Somebody blew through an intersection and kind of T-boned my car. And I was not seriously injured at the time. I had a concussion. I had seatbelt trauma. I developed pneumonia within a couple of days of the accident, which I don't know if it's related or not. But within 24 hours of the accident, I started to have unusual pain. We had a torrential storm and we were without power for days. And I remember it was the day after the accident. My husband needed a coffee. And so I went to downtown St. Lambert to get him a coffee. And as I stepped off the curb to cross the street, I felt pain in my SI. And I thought, well, that's a little odd. I don't usually have pain anywhere. And I walked across the street. I got the coffee. And then walking back to my car, I felt pain in the knee on that same side. And the pain was sort of diagonal. I had shoulder pain, left shoulder pain. I figured from the seatbelt. I had some bruising from the seatbelt trauma, but it was left shoulder, right SI, right knee, right ankle. It sort of crossed my body. And I thought, well, this is normal, right? You know, I just had a car totaling accident that involved 2 impacts. The guy hit me so hard that my car spun around and hit him back. My car was crushed both front and back, which was a little odd. And in the short term, the most obvious discomfort I had was in my shoulders. I had severe headaches. I had neck pain. I had shoulder fatigue, brushing my teeth. My shoulder would be just so tired from brushing my teeth. Small repetitive movements were very hard. Scrubbing a dish. And in the short term, I went to the doctors who told me that I probably had chronic whiplash. I saw the doctors I saw a surgeon, I saw a neurologist, I saw general doctors. And the list of diagnoses that I collected, I had chronic whiplash, I had micro tears in my rotator cuff, I had atrophy of my trapezius muscle, you know, and most of the things they told me were sort of more descriptive of my symptoms than getting to the root of why I hurt. And so after about 6 months of doctor's visits, and I'm from the States where you got to pay for your medical care. I don't go to the doctor unless my butt's on fire. You know, it's not in my nature to preventatively go to the doctor. And in 6 months, I accumulated 10 times more doctors I had in my entire adult life. And at the end of the process, aside from lowering my respect for doctors in general, I was referred to the hospital pain clinic. I was told that there is a 2-year wait for someone to phone you for an appointment, and that I was not to call and ask for the appointment. I was not to call and ask when they would call, that wait 2 years and someone will call you and book you an appointment to be seen. And it was funny because I was kind of just trolling through things the other day and I realized no one ever called me. I never received a call for that appointment. But at the time, my quality of life was very poor. And I just said, you know, what are they going to do? They're going to teach me to meditate and do yoga and relax and learn how to live with pain. They're not actually going to tell me why I hurt or if it can be fixed. And at that point, I decided, you know, that I had 2 young kids. I need to be able to live. You know, I can't just lie down and suffer. I had at that point developed a habit of swallowing anything that would dull the pain. I began to understand how people accidentally overdose by mixing medications. Everything I took was over the counter, except for the cocktail of drugs that was prescribed by a neurologist, which did nothing for my pain but made me sleepy and stupid. Couldn't even remember my name. And so I didn't take those. But I started to exercise. I started going to a boot camp. I'm like, if I have to hurt, it's going to be the hurt I choose and not the hurt that was handed to me. It's going to be, I can say I have delayed onset muscular pain, not I hurt a different place every day and I don't know why. And my life did get better at that time, but my habits, my exercise habits are, as Michael knows, a little bit compulsive. And I exercised so much that I think I started to become the architect of some of my pain, where my habits were blurring into my inexplicable pain. And I developed the habit of maybe for 2 hours a day, just doing self-care, getting out my Theracane and digging it into my traps, getting out my little evil looking wedge and digging it into my piriformis, finding a different painful wedge and jamming it into my psoas, because everybody told me I had all these things. My list of diagnoses: I have a sore psoas, I have a tight psoas, I have a weak psoas, I have weak hip flexors, I have piriformis syndrome, you have sciatica, you have chronic whiplash, you have muscular spasms, trigger point problems. And in all of those years, I saw 4 different osteopaths. I saw 3 different general doctors. I saw a shoulder surgeon. I saw a neurologist. I had general massage therapy. I had active release therapy. I had trigger point therapy. I had acupuncture. And my pain management, aside from the 2 or 3 hours a day that I was performing all of these things that were asked of me, was costing me $200 or $300 a week in all of these specialty treatments that were expensive Band-Aids. I have respect for all of the people who rendered these services, but sometimes it didn't make it all the way to the car before I was in pain again. And all through the whole process, I just said, if I only knew why I hurt, I could accept it a little bit better. But every day I woke up, it was different. Someday I would wake up and it was my SI. The next day I'd wake up and I completely lost dorsiflexion in my left foot. And I'm flapping around my house for a few days without being able to lift my toes. And it was really perplexing. And I found Michael by accident. I had tried everything that had ever been recommended to me. And the only thing I didn't try was chiropractic. Not a fan, no disrespect to chiropractors, just not for me, particularly around my neck. I had MRIs and radiographs, and my neck is a radiographic disaster. I have collapsed disc spaces in the majority of my cervical discs are gone. I have significant osteophytes. I have spinal nerve root entrapment in multiple locations. And I was a horse person as a young person, and my pony was really good at shaking me off. And so there was just repetitive head snap. And I'm sure that's when all my discs went away or set me up for that to happen. But, I would go through periods of time when I would fall down. I'm walking and my knee would I'd take a step and my knee would go into flexion and I would fall. I had to walk my dog with a phone in case I fell and couldn't get up because I wasn't sure where it was going. I wondered if I had MS, because some of the numbness in the hands and feet seemed sort of similar to that. And my son, who is now going to be actually 21 years old on Tuesday, at the time, he was just approaching his teenage years, and he worked out in a gym. He was a football player, and he had started to lift some pretty heavy weights about 4 years ago, around the time I began to see Michael. And he developed bilateral shoulder, elbow, and wrist pain. And I said to him, it doesn't make sense to me that your joints would simultaneously all hurt. I said, it sounds like a cervical issue to me. And I had a friend in the gym who was a physical therapist, and I was saying to her, what do you think of this? And she said, I agree. It sounds like a cervical issue. You should go see Michael. And her stepdaughter had been seen by Michael for a back injury, and she had so many good things to say. So I booked an appointment for my son to see Michael. And the first exercise that Andrew had to do was a prolonged cervical extension. And because he was a little bit resistant to the idea of what Michael was asking, I did it with him. So I said, okay, let's do it together. And then you can see what I'm doing and I can see what you're doing, and I'll be your mirror.
And just to give the MDT terms, it was sustained prone retraction extension.
Yeah.
That was the loading strategy.
And so I did that with Andrew before I went to bed. And for the first time in years, my arms didn't burn while I was sleeping. I fell asleep. My arms weren't burning, because my burning in my arms would happen usually in less than a minute from when I would lie down. My arms would start to burn, or my hands would go numb, or I would have a feeling of pressure. And so the very next day I got up and called the clinic and booked an appointment for myself.
I see.
So my son was in therapy, and just helping him to do his, I said, wow, Deb needs this too. And
let me ask a question just for 1 second, Deb. And thanks for going through that thorough background, because it does help us appreciate to the extent to which you were hurting and how long, and all the help that you had sought without having much success. Michael, if you can reflect back, when you met Deb and she started sharing this similar story with you and all the places that she hurt, a clinician might think, oh, we've got, the potential of some significant yellow flags here. And we can talk, Deb, about what that means. You guys may have discussed that. He may have shared that with you. But the mind and body are connected, and we know that there can be influences on our physical body from how the brain perceives threats or perceived threats. And so, Michael, when you heard this, to some clinicians, they might think, oh, we've got a case of fibromyalgia here with broad, widespread symptoms everywhere that didn't have a plausible reason that she should be hurting in that many areas just from, a significant impact, but one that was seemingly should be recoverable, be able to be recovered from. What were your initial impressions just upon hearing her describe her symptoms?
I wish I could say my initial impression was, this is going to be easy piece of cake. Here we go. But no, obviously, what you're saying is absolutely right, Jason. Someone presents with this kind of a history, and we realize, there are a lot of barriers here in front of us. There are the psychological barriers, there are the cognitive barriers, some emotional barriers, the history of burnout from the job, that there's stress involved in life. So right away, one of the first things on my mind was, there are all these barriers.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com. Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.